is costoclavicular joint. So, first of all, the anatomy of joint, location and boundary. The costoclavicular joint is an synovial articulation between the first rib and the inferior clavicle. It occupies the costoclavicular space bordered by the subclavius muscles anterior and the first rib posteriorly. The junction stabilizes the clavicle and limits excessive elevation of the shoulder girdle. Next is ligament and capsule. The joint capsule reinforced primarily by the costoclavicular ligament, a strong oblique band anchoring the clavicle to the first rib. Accessory fibers and the clavius muscle provide additional support. Clinically, the costoclavicular ligament is central to stability. Injury may cause pain and restricted scapuloclavicular motion. This is the figure of costoclavicular ligament. As you can see here, as shown, costoclavicular ligament. Another relation with thorax. The costoclavicular joint lies between the clavicle and the first rib, closely related to the subclavius muscle and subclavian vessels. Its position contributes to the thoracic outlet anatomy and may influence neurovascular structure under stress. Function and clinical. Biomechanics and the movement. The movement functions as a stabilizer, limiting clavicular elevation and permitting small translational movement during shoulder motion. Its integrity is essential for normal scapulothoracic kinematic and force transmission across the shoulder girdle. Here you can see this lady is having a pain and in this area. Common injury and syndrome. Injuries include ligament sprain, degenerative changes and contribution to thoracic outlet syndrome. Patients present with pain on shoulder elevation, focal tenderness or neurovascular symptoms when costoclavicular space narrows. Another is diagnostic and treatment approaches. Diagnosis use targeted clinical exam, dynamic imaging and neurovascular testing to assess compression or instability. Management range from conservative therapy, physiotherapy and actively modified to injections or surgical stability in refractory cause. Conclusion. The costoclavicular joint is small but clinically significant for shoulder stability and thorax outlet relation. Early recognizing of dysfunction enable effective conservative care. Surgical options are reserved for persistent instability or compression. Thank you.